Good morning. My name is Jason Piotrowski, and I'm a Bloomberg Fellow studying addiction and overdose. I work just over the Delaware River in New Jersey, and I'm currently a captain in the New Jersey State Police. For more than 9 years, it's been my job to work on the overdose epidemic. During 2013, we created the Drug Monitoring Initiative, which provides complete surveillance of all naloxone administrations by first responders in the state of New Jersey and all drug seizures reported to forensic labs in the state of New Jersey. We use this data to identify trends, patterns, and emerging threats in the drug environment, but more importantly, we use the data to support the people, the families, and the communities that are most affected by substance use disorder. Earlier this year, we received a federal grant that's going to allow us to hire 8 recovery coaches and 2 supervisors, and they're going to help the New Jersey State Police to further reduce community drug harms. As we all know, this epidemic, there's been not a lot of great news, but I'm actually very happy to give some today. Through our partnerships with public health and treatment, prevention, community leaders, harm reduction professionals, while one overdose is still too many, this year, year to date in New Jersey, we're down more than 10% in overdoses. It's now my pleasure to please welcome, to introduce the next panel. Please welcome Commissioner of New York State, Office of Addiction Services and Support, Dr. Chinazo Cunningham, Professor of Epidemiology at Brown University School of Public Health, Dr. Brandon Marshall, Senior Director of Programs at OnPointNYC, Kailin See, and your moderator, staff reporter at the Philadelphia Inquirer, Aubrey Whelan.
Thank you so much for that introduction, Jason. I'm really excited to be here. Let's get to it. So yeah, New York City opened the first supervised injection site just about a year ago. Kailin, I'm hoping you can tell us a bit about how it works and what sort of challenges and non-challenges you faced in opening it. What was easy, what was hard?
Yes, so I'll rapid fire this because we don't have a lot of time, but November 30th, 2021, the first 2 safe consumption sites in the United States were open, y'all. Let's have it. Yes, they exist. They are safe spaces where people who use drugs can bring illicit materials and use them safely under the supervision of a trained staff. The sites have been used over 50,000 times. They've intervened in 633 overdoses in their first year, calling the ambulance only 10 times. And we have, thank you, yeah, let's clap for that. Quickly, yes, we have no time. And we have 2,200 registered participants at the sites.
Awesome. And what is the funding model for the site? How do you guys work?
Yeah, that's the tricky bit, thank you. So because we don't have federal permission or state permission officially to operate the sites, funding is the big question. So no public dollars can be used to operate the sites. And for any jurisdiction that's thinking of opening their sites, and I know that Philadelphia is, and we're with you all the way in that effort, really securing sustainable funding for this evidence-based public health initiative is going to be key to scaling up this life-saving intervention across the country. So we're really optimistic that the Opioid Settlement Fund money can be used, and we really are calling on jurisdictions to advocate hard for those public dollars to go to operating these sites. For now, it's foundation and discretionary money and donations, so it's a tough position to be in.
Dr. Marshall, you are in Rhode Island, which is also approved sites, but hasn't opened them yet, and it went the legislative route. Can you talk about that? And I'd love to hear from you as well, Dr. Cunningham, about kind of how in New York you guys are working at a state level, because I know that the OPSs are operating at a city level in New York City.
Sure. So we were the first state in Rhode Island to authorize overdose prevention centers through legislation, which passed, I might add, with broad bipartisan support.
Yes.
And we also recently are now, as a state, financially supporting organizations that wish to open an overdose prevention center using our opioid settlement dollars, which is allowable under that agreement. So I think what this shows to me, right, is that harm reduction is achievable, and the broad public and political support for harm reduction can happen. And I think Rhode Island shows that. You know, that's really it. Until we think about harm reduction as a key component in a continuum of services for people who use drugs, we're not going to see the end of this crisis. That's simply it. And so we're leading the way, and I do hope that many other states and jurisdictions follow us.
I would absolutely agree about really thinking about harm reduction and embracing it in terms of all of the strategies that we use across the state. And this is something we're doing in New York. So I've been the commissioner for a year, and really my leading priorities are harm reduction, a data-driven approach, and using an equity lens in everything we do. And in terms of the kinds of harm reduction policies and activities that we're supporting, including really expanding harm reduction supplies, so naloxone, fentanyl test strips, and supporting syringe services programs, bringing services out to where people are, so really going out into the community, bringing methadone out into the community through mobile units, doing outreach on the streets, on the corners, under the bridges, linking people to care. And so really thinking about harm reduction as a full continuum to reach as many people as possible and those who are at the highest risk.
Yeah, I'm curious if any of you can talk a bit about community outreach, both to, and I hate to draw the distinction between, the community of people who don't use drugs and the community of people who do this. They're all one community, as we all know. How do you do outreach to people who requires harm reduction services, and also people who are living near, the places where these harm reduction services are distributed, and kind of how do you get people on board or, get them acclimated to the idea that, say, there's going to be an overdose prevention site next door?
I think it's important to remember that we open and operate programs for two different stakeholder groups. One, the people who are going to use the programs, but we also open them to address the needs of the people who live in the neighborhoods where these programs are going to be sited. So for us, it was really about acknowledging that there were no American examples to point to, and that we needed to be fully transparent and patient with the communities where our sites were operating, and allow that conversation and allow those deeply held feelings that people have about drugs, drug use, and people who use drugs to come up and not shy away from that conversation. So from our perspective, we opened our doors. We've been open for just over a year, and we've hosted over 400 tours, and we felt that we had a responsibility to do that. So our public engagement strategy was a little bit more after the fact. Sometimes it's easier to ask for forgiveness than permission, especially when you're going to be opening the first 2 safe consumption sites in the United States. But that has really been a winning strategy. When people come and see the sites and how they operate, they understand that we're trying to meet the needs of 2 stakeholder groups, that it is evidence-based, and it is solid public health strategy, and that's won the day for us.
I would also just add to that in terms of who should be doing outreach, what that should look like. It should be everywhere, right? So it should be community-based organizations doing outreach in their community. It should be prevention, treatment, and recovery providers as well. I mean, we have to do things differently. We are at the worst overdose crisis ever in our country's history. And so we have to get outside of the walls of the traditional way in which we've been providing care, and we have to go into the communities. And so supporting all of the service providers is really critical.
I know that obviously, yesterday there was a deadline in the case here in Pennsylvania or in Philadelphia to open a supervised injection site that the federal government has asked for another extension on. I'm curious as to, what either any of you think on, sort of efforts around the country outside of your own jurisdictions to open these sites and how it compares to what you did.
Yeah, these delays are harmful, right? Every overdose death is preventable. And these sites can save lives. They start saving lives the days with which, after which they open. And so these delays are harmful. I think we need to move towards implementation in jurisdictions as rapidly as feasible, and a stronger indication from the federal government that this is an evidence-based intervention that can and should be rolled out in communities that are highly impacted by the overdose crisis would go a long way, I think, to seeing these interventions open and foster and thrive in communities across the U.S.
Where is Rhode Island in the process right now?
So we are financially supporting these sites as a state through our settlement dollars. That RFP went out and organizations have applied, and we're expecting that funding to be released early in 2023. The legislative and regulatory process we took is slow, and I won't be happy until a site is physically stood up and open. But what we've seen is broad support politically, publicly, through that process. So I'm hopeful that we're building a strong foundation from which to continue to grow and see support for harm reduction more broadly, not just overdose prevention centers.
Can I add one tiny thing
Please.
to that? One thing that I think is evident is post-opening the sites and because of what's happening in Rhode Island with the legislation is the harm reduction community nationally is working together in a very different way around the launching of the sites. And each jurisdiction will find its own path, whether it's declaring a public health emergency or going the sort of very rapid surprise, non-regulated route that New York went or the legislative route that Rhode Island went. But the harm reduction community and government stakeholders across the country are interested in opening these initiatives and really proactively taking steps.
Dr. Cunningham, in states that are, like Pennsylvania, where we have, kind of more radical interventions trying to get implemented in some of the larger cities, but, there's not statewide syringe access, for example. What can places, with very different pictures of the opioid crisis, what can states do to kind of address, the different access issues across a very broad spectrum of people?
Yeah, so certainly in New York, we have a very large state, and we have all the way from New York City to the North Country, which is the area that borders Canada, and they're obviously very, very different communities. And so I think what's really important is to understand what the challenges are in each of the communities, and then think about the potential solutions, which are going to be different. And then I think the other thing is just really learning from each other. I hear sometimes, what happens in New York City can't happen in these other places, and that may be true, but I think we can sort of tweak, we can learn, and we can tweak our approaches accordingly. So I think that is the job of government, to really think about the specific differences and challenges and then meet those challenges.
Great. Thank you, guys. This is just about time. It's been a wonderful discussion, and you were all very quick, so I appreciate that. Thank you so much.